From Global's newsroom at 3 o'clock, more rain, sleet and snow are on the way as a danger to life flood warning has been issued for the River Soar in Leicestershire. People living at a number of caravan parks in the region have been told to leave. One man had to be rescued on a raft in Barrow-upon-Soar earlier. Spencer is volunteering with his 4x4.
I'm from Lincoln, but Leicester is the worst. It's absolutely hit this county so badly. They've got a lot of volunteers here with the 4x4 responder charities. They need more. They really do. There's sandbags being given out. They're doing evacuations at the moment.
The pressure on emergency services comes as 4 NHS trusts have declared critical incidents. Warnings have been issued at hospitals in Plymouth, Hampshire and on Merseyside. The Health Secretary Wes Streeting will be taking your calls on LBC with Shelagh Fogarty next. A former Conservative Attorney General has accused the Tories of acting like a little Sir Echo to Nigel Farage's Reform Party. Dominic Grieve has criticised the Shadow Cabinet for demanding a national inquiry into child grooming gangs. He's told LBC News claims made by Reform and Elon Musk are baseless.
Their anxiety about Mr Farage and Reform means that they're just acting as a little Sir Echo to the demands that Reform have been making, because they never asked for such an inquiry. And after all, we were in office in 2010 to 2014.
Earlier, Nigel Farage refused to condemn allegations made against the safeguarding minister Jess Phillips by Elon Musk. A man has denied helping former soldier Daniel Khalif escape from Wandsworth Prison in September 2023. 25-year-old Imran Chowdhury from Chingford has appeared in front of magistrates this morning. And far-right French politician Jean-Marie Le Pen has died at the age of 96. He founded the National Front Party, which was later taken over and rebranded by his daughter Marine. He was expelled in 2015 for his views on the Holocaust and saying France's World Cup winning football team had too many non-white players. In the city, a short time ago, the FTSE 100 was trading down 9 points at 82.40. The pound buys $1.24 and €1.20. LBC weather, further snow showers in northern Scotland, wintry showers for Northern Ireland, Wales and northwest England. Largely dry and bright elsewhere, but cold and breezy. A high of 8 degrees. From Global's newsroom for LBC, I'm Amelia Cox.
This is LBC from Global, leading Britain's conversation. Call the Cabinet. Put your questions to the Health Secretary Wes Streeting now.
Hello there, good afternoon to you. The Health Secretary Wes Streeting has just put his headphones on, ready to take your calls here in the studio for the first official Call the Cabinet taking place on my show. We're launching it on my show. I'd say a soft launch, but it's not going to be a soft launch, Wes Streeting. The job is the job is yours now.
No one's ever called you soft.
No, the job is yours now, and you know how tough the job is. I want to get straight to it to give as much time as possible for callers. I began the programme talking about the NHS and the crisis in accident emergency and ambulances. Spoke to 2 excellent journalists who focus on health a lot, Sean Linton and Liam Thorpe of the Liverpool Echo. I'll put to you a question I put to them. If what's going on in our accident and emergency services, including ambulances, isn't a national emergency, some people waiting 91 hours in Liverpool, an 88-year-old woman being in 5 different ambulances, hours on end, eventually getting treatment, but suffering badly in the meantime, a frail old woman. Just 2 examples that came up in our conversation. If these things, repeated and repeated and repeated and repeated as they are being, aren't a national emergency, what is?
Well, this is one of the reasons why, literally on day one in this job, I said the NHS is broken. Is not beaten, but I was extremely forthright, attracting some criticism for being that blunt. Because, I mean, especially at the moment, and I know we've got this extraordinary pressure on flu, where we've got between 3 and 4 times as many hospital beds taken up with flu cases this time this year than we did this time last year. But even so, annual winter pressures should not lead to an annual winter crisis. And when
And it's an all-year-round crisis now.
Well, indeed.
With ambulance
and in fact,
queues.
over the Christmas period, I popped into the Derriford Hospital in Plymouth to have a look in their A&E department, which I've seen at both times of the year. Actually, I've seen the Derriford at the height of summer when I was in opposition. I've seen it in the depths of winter. Now I'm in government. This is an accident and emergency department that, despite the best efforts of its staff, is one of those ones that pops up pretty much every winter crisis because they have particular challenges in that department. And they've got a great new chief exec that's gone into the hospital trying to help turn the situation around. But when I hear you describe that poor 91-year-old woman going from ambulance to
88-year-old woman,
88-year-old
separate patient waiting 91 hours in Liverpool.
Excuse me, I got my numbers.
That's all right.
But the 88-year-old woman going from ambulance to ambulance to ambulance to ambulance, I feel the same emotional reaction
without
I felt.
treatment.
Yes, indeed. I felt the same emotional reaction I felt when I was going around one of my local hospitals just before Christmas. And when I went in, they said, actually, you're here on a fairly good day. It's not too bad today. And as I was walking through the emergency department, I was looking at the corridor care that's become a normal feature now in our hospitals. I went through a section of the emergency department where there were lots of frail elderly people, including people with dementia, who were very confused, very distressed, crying out, not so much in pain as much as confusion. Yeah. And as I walked around these conditions, I was looking around thinking, this is a good day. And in the run-up to this winter, we did a whole number of things to try and help with the limited time we had between the election and now to make sure that we've got the first winter without strikes for the first time in 3 years, to give a big boost on the vaccination campaign, especially with the new RSV vaccinations, help with respiratory conditions.
Doesn't seem to have worked with the flu jab, though, does it? And I had people calling to say they couldn't access a COVID jab.
Well, COVID is a feature. It's not been as bad in recent weeks. Flu, I mean, we've actually got more flu vaccinations done this year than we did last year. But it is a big problem. And as I said, nearly between 3 and 4 times as many beds occupied by flu as last year. We did lots of things in the run-up to this winter to prepare. We've got a very good national operations centre where we can actually zoom right into not just individual emergency departments, but actually look at individual patients and long stays, where particularly in mental health, we've got people staying for days on end because there isn't an appropriate mental health bed or facility for them to go to. So what I would say to people is 2 things. Firstly, I am never going to pretend, for as long as I've got this job, that when there are problems that everything's all right. And I'm not going to try and gloss over problems as they exist. I will do everything I can, and I'm doing everything I can, to make sure that year on year we see consistent improvement. It is going to take time. And in the meantime, I feel genuinely distressed and ashamed, actually, of some of the things that patients are experiencing. And I know that the staff of the NHS and social care services feel the same, because this is, I mean, they go to work, they slog their guts out, and it's very distressing for them seeing people in this condition as well. In fact, one of the guys I saw with his mum in a corridor at one of my local hospitals, when I said, how long have you been here? And he was talking to me about his mum's care, and she was actually in fairly good spirits for someone who's in a bed in a corridor. They were both at pains to say, because I said, "Oh, this is awful," and they said, "Yeah, but the staff couldn't be working harder."
I get that, and I think we all get that. But I think we've gone past saying, "But everybody's doing their best."
I agree with that.
Obviously, people need care. The staff need to be cared for in all of this. Absolutely, that's not to dismiss the pain that they're going through at all. But in terms of solutions, yesterday we had the announcement, the Prime Minister setting out the plan to tackle the hospital backlog of elective stuff.
Yeah,
just outline as quickly as you can, because I want to get to calls. What is the plan? You announce a plan for elective, and there may be calls about that later. But what is the plan for A&E and ambulances? What is that plan? And when will we start to see things turning around positively rather than negatively in terms of flu numbers, hours, waiting? Because, my God, this has to change.
Yeah, and we're going to have an urgent and emergency care reform plan in the way we've done on electives, which we'll be publishing shortly, and we're actually reflecting right now. One of the things I'm doing this winter is actually planning for next winter and thinking, what am I seeing, what am I hearing, what am I learning from now to apply to improve things next year. So look, on what are the practical things? Partly this is about taking the best of the NHS to the rest of the NHS, because there's quite a wide variation of performance. For example, there are some trusts where and Amanda Pritchard, the Chief Executive of NHS England, and I saw this up in the northeast of England, where people are ringing up 999 or 111. They are actually being triaged to community response teams who are able to get there faster and often provide care in people's homes and manage them in the community to avoid the ambulance from having to go there and avoid an unnecessary A&E attendance. Similarly, in London's ambulance service is running something called Release to Rescue, which is speeding up the handover process from a patient out of the ambulance into the A&E department, which is challenging. And sometimes
can't do that if you're in a 26 ambulance queue, can you?
And sometimes the queues build up because emergency departments are saying, well, hang on a minute, we can't take these people in right now. And when they're in your ambulance, they're your problem, not ours. And actually what we're saying to people is, you are creating intolerable patient risk for the people that the ambulance won't reach. So release the ambulance so they can rescue others. But also at the other end of the system, and the reason why we can't get people out of emergency departments on towards where they might need to be is because of bed blockages, and that's social care. And last week when I was in Carlisle, I was in a care home that was offering intermediate step-down care for NHS hospitals. At half the price it cost us for the hospital bed up the road the patient had been in, we were able to give them ensuite bathroom facilities with rehab in care homes. So I've got to make sure that kind of thing is happening across the country. Well, that's
the point I was going to make. They're good examples, but it needs to be scaled up massively, doesn't it?
And we will. Change takes time, but I've got my foot down on the accelerator.
All right. Melissa's called from Salisbury. Hello, Melissa.
Hi, Sheila. Hi, Wes. First-time caller.
Hello.
Be gentle. Hi. I have worked in the NHS as a doctor for 26 years, and for 13 of those I've been a consultant surgeon. Now, how do you expect to deal with a backlog of operations when senior consultants are actively reducing their working hours due to taxation and pension issues? I note that the Judiciary Pension Review in 2022 removed the annual allowance and lifetime allowance to their pension schemes, but this has not been offered to senior clinical staff. Furthermore, the overtime rate in my institution hasn't been reviewed in more than 8 years. And also the Clinical Excellence Awards that we were able to apply for previously, this scheme has been abandoned. So what incentive do I have, Mr. Streeting, to work more?
Okay.
Well, I do recognise the importance of the workforce to turning the NHS around. That's why within weeks of coming in, the Chancellor agreed the public sector pay review body recommendations to make sure we gave NHS staff the uplift that had been recommended, and we acted within weeks to end the junior doctors' strikes with a resident doctors' deal to move forward. I recognise the issues you're talking about on pensions. I actually pressed the previous government, and I think we successfully campaigned to get the previous government to move on the lifetime allowance on pensions. I know the BMA are saying there are still some issues there, which I'm willing to look at and work through. What I would say, because there are obviously financial pressures attached, and I hope you'll forgive me for saying this, I don't mean this in a critical way at all, but in terms of some of the pay pressures in the NHS, in some ways I'm less worried about the consultant body because we need you. I value your expertise and we should pay you for your skills and experience. But I am particularly worried about the people who are lying awake at night unable to pay their bills. And in terms of the wider pressures in the NHS, I've got constant juggling act in terms of where we need to put money and investment to improve services as well as reform. So I am doing as much as I can, as fast as I can. It's why the budget was important. We will work through these issues with the BMA in a constructive way and trying to build a new mutual respect between the staff of the NHS and the government.
Because we only have half an hour, I won't go back to Melissa for a comment. I hope you got the answer that you wanted there. Just before we speak to Shivam, on pay, the Chancellor, you were talking there about people worried about paying their bills, lower paid staff in the NHS. Chancellor Rachel Reeves said 0.2% rise above inflation was all that could be offered due to the challenging financial circumstances. The BMA says this shows that the government has a poor grasp of unresolved pay issues. Yes, you resolve some, but some are ongoing. In response to that?
Well, I think this was in reference to the recommendations that were put into the pay review bodies in terms of what the government has said to the pay review bodies we can afford. We 2.8% is what my department sent in, what I sent in. But this is the beginning of the process, and I dare say the pay review body is going to consider all of the representations, including from the unions, and come up with a figure. And it could the recommendation may well be higher. So watch this space. This is a journey, not an event.
Sorry to rush you, but I'm keen to get as many calls and not neither you nor I to hog the airwaves. Shivam in Fulham, hello.
Hi there.
Hello.
What did you want to say? What do you want to say to Wes Streeting?
Hi, I'm a doctor, and thanks for having me. I was actually going to ask about pay and ask because you talk about transforming the NHS with AI, hubs and 7-day diagnostics, but how will this happen with a 2.8% government pay recommendation? You said the pay restoration is a journey, not an event, but this recommendation is putting us further away from pay restoration, and it will result in further strikes, not just from overworked, underpaid doctors. And as a resident doctor, you also agreed to more specialty training jobs and reforming rotational training, the latest deal. And currently doctors rotate every 4 months to different specialties. This is ripping apart medical teams 3 times a year. It's terrible for productivity, patient care, and morale. And separately, there are also UK doctors facing unemployment due to training numbers remaining stagnant for the decade and massive rise in competition ratios. This is a time when we need all hands on deck. So how developed are the plans that you agreed to reform rotational training and increase training numbers to deliver the consultants of the future?
All right, Shivam.
Yeah, we can definitely move faster on rotational training, and I'm very keen to work with your profession and your representatives to do that, because I recognise totally the challenge you've just mentioned. I don't think it's good for staff. I don't think it's good for productivity, and we can work together to solve that. On pay, I would just gently say we did within 3 weeks strike a deal with your representatives in the BMA to end the strikes and to try and move forward in a new spirit of collective partnership. I know, I mean, it goes back to, I've spoken to another one of your counterparts and the consultants on the previous call, and this will be true across health, across social care, across every part of the public sector, and indeed people working in the private and voluntary sectors too. You just got to bear with us here. We've got a big challenge as a government, both in terms of the state of the economy, the state of the public finances, and the state of the public services. I hope the fast action that we took for resident doctors and with resident doctors reassures you of our determination. Change is going to take time. We're doing as much as we can, as fast as we can, and we're determined to work with rather than against professions. So let's just try and work through these challenges together.
Shivam, I hope you think you got an answer there. Beverly in Leeds, hi.
Hi, can you hear me okay?
Yes, we can.
Okay, hello Sheila, hello Wes. This is about social care. My mum's 97 and she has dementia. She's in a care home that costs an eye-watering £1,650 a week. That's over £85,000 a year, and that increases annually, and it's rapidly just cleaning out all mum's savings that my late dad put aside so carefully to give us all security in our own old age, plus the proceeds of the sale of her home. And it sounds really terrible, but sometimes I even find myself wishing that my mum would pass away soon before it's all gone and the family's left with absolutely nothing. And it shouldn't be about money, but unfortunately it is. I want to know, when will something be done to stop this happening? And I need a real answer, not just a sort of, we get it, we have no money kind of answer.
All right, well, let's see if he's got it. Go on.
So within the first 6 months on social care, we have delivered the biggest expansion of carers allowance since the 1970s. We have legislated for fair pay agreements so we can deal with the workforce challenges. We just announced £86 million going out the door between January and April to do home adaptations for nearly 8,000 disabled people across our country. And there is more to come on social care, and not least thanks to the measures the Chancellor took in the budget to increase funding. But I do...
on that, very little increase compared to the wider NHS, and you know they are absolutely hand in glove. In terms of the solutions.
There's a few things. There's, in terms of the spending power of local councils, that went up significantly, and just shy of £4 billion, 880 million ring-fenced specifically for social care, but that won't be the grand sum of it. The Disabled Facilities Grant on top. And there are, in terms of reform of the Better Care Fund, I'm trying to drive the NHS to do more with and through social care, because often it's better value for taxpayers.
Now, remind me, Better Care Fund, is that where money from the NHS goes into the care sector?
Yeah, it's a sort of shared fund to look at health and care services, and it's to help ease pressures on the NHS too.
And in terms of the question that you were asked about the sheer expense that
catastrophic care costs that people are going through, I recognise this is a really big challenge, and when people hear case studies like yours, I mean, those are eye-watering sums of money.
And not unusual with dementia.
No. And that's why, because I think that where we've got to as a country is a situation where I think the burden on individuals and families and the state, it's imbalanced, and it's almost a game of potluck and chance.
Is the heavily privatised nature of social care part of that problem?
Actually, it's more, I mean, there are definitely issues with private equity-owned care homes. It's more to do with whether they're state-run care homes or whether they're privately run care homes. The costs are enormous. And for people who are on the receiving end of this, it will not feel like a game of potluck or chance at all. It will feel catastrophic. And why should you be hit harder if you've got a condition like dementia than if you've lived into a ripe old age and you're okay?
You're asking questions now rather than answering them.
And that's why I've asked Louise Casey, who is one of the best social reformers and doers in this country, to lead an independent commission on adult social care, reporting initially next year to set out actions we should take through this Parliament, and then for the long term.
And you've been criticised for that being too far away, but it is what it is.
I'm willing to have that row, but you might not want to now.
On that, I'm going to get to calls as much as I can. But on that, Dame Louise Casey's review, is it as much about finding out new things that we don't already know? What don't we already know about the problems in social care? I would argue we do already know the problems in social care. Or is she looking at coming up with a package of how we fund it differently?
So much more about the how than I mean, there'll be a bit of what's the state of play, because we did that with Darzi on the NHS when we came in, and we got criticised at the start. Well, what you been in? Why are you asking for a review for? You know what's wrong. And even people who've worked in the NHS for decades, like Lord Darzi, were going, bloody hell, I didn't realise it was this bad.
Okay.
And I think we're going to see a bit of that in social care. So the evidence base is important, but it's about action. So it's about action during this Parliament. And then why have this review for the long term? You've got a massive majority. Why don't you just do it? Because what I've seen on social care time and time again over decades now with Labour, Conservative, Lib Dem and SNP-led governments is politics has torpedoed good ideas, and it has broken the social care system. Bad politics equals bad social care. And what I found after the general election is, and to their credit, especially given some of the things I've said about the Conservative Party in recent days, the Conservatives, the Lib Dems and Reform have all said, look, we're willing to work with you on this in terms of the long-term plan. So let's see if we can get broad agreement.
Can I just say, as an ordinary voter, to that statement you just said there, Yabu, so you bloody should. All of you. You should.
Yeah, definitely.
It's your job.
And that was the argument I made during the election campaign, which was, we've all got blame to hold in this crisis. I mean, on the NHS, I'd be more critical of the Conservatives because we left the NHS in a better state. On social care, I'd say, yeah, do you know what? Labour, Conservative, Lib Dem, SNP, we've all got a share in the blame, and I think it would be a good thing for social care and a good thing for our politics if we could work together to build the broad consensus like we've got on the NHS or state education and other issues that we've had in this country on other areas of public service. Let's do this on social care and let's do it together.
Well, you could argue we don't really have that big a consensus these days on the NHS, but that's a whole other conversation as well. Alistair has called from Stow. Hello, Alistair.
Hello there. Hello, Wes. I've got a bit of an affinity with you that 10 years ago today, I lost a kidney due to kidney cancer. Now, my question is that I am fully in favour of you using capacity within the private sector. But what I want to know is how the NHS actually is sure that it's getting good value for money. And the reason that I ask is that by mistake, I got to see that the private hospital in which I had my kidney removal was charging the insurance company £100 for a box of cocodamol that I was sent home with after the operation. So how do you ensure that the NHS is not going to be ripped off in the same way as the private hospital was ripping off the insurance company?
Well, firstly, I'm sorry to hear that you're also part of the club that nobody wants to be part of, the Cancer Club. But I'm also glad, like me, you're still here to tell the tale. And we've done an agreement with the independent sector, with the private sector, which is we will work with them to bring down NHS waiting list, because I believe as a point of principle that those who can't afford it shouldn't be left behind while those who can afford it are paying to go private. Where there is spare capacity, let's use it. But as part of the agreement, it has got to be genuinely spare capacity. We're not having the independent sector robbing Peter from the NHS hospital to treat Paul up the road at the private hospital. And also they're going to work with us. I mean, thinking about some of those earlier calls we got from some of the doctors about some of the bottlenecks in training, the independent sector are going to work with us to play their part in training staff as well. So there'll be some get for us on behalf of patients, which is we're getting faster access to treatment, and we are also getting the private sector playing their role in training and making sure we've got good value for money. What we're giving them in return is some consistency, and we're going to be a reliable partner, and we're going to work together to get waiting lists down, free at the point of use for patients.
Alistair, I hope that was an answer that you thought was satisfactory. Marisa has called from Leatherhead. Hello, Marisa.
Hi there. I just wanted to ask what you are going to do to support GP surgeries. I was recently made redundant as a practice nurse in a GP surgery, along with 4 receptionists and multiple GPs. The services that are now being offered to patients have been cut. There's no one there. There's been no vaccinations being done, no cervical screening being done regularly. This seems to be happening more and more, and I see it a lot in papers. But what are you going to do to protect those staff, protect those patients who need to have a service where they can go and see a GP as opposed to seeing a physician associate? And as you probably know, Wes, there's been a lot of recent talk about replacing GPs with lower paid staff or lower qualified staff. Obviously, there is a place for them, but we still need our GPs. So can you tell me what you're going to do?
Yeah, so within weeks of coming in, we put in place just shy of £100 million to put 1,000 more GPs onto the front line before April. We've recruited hundreds of those already. We'll be doing the rest in the coming weeks. Just before Christmas, I announced as part of the funding package we won in the budget from the Chancellor, £889 million for general practice, the biggest uplift in funding they have had for years, so they can recruit the staff. I mean, when I came in, we've got this bizarre situation where we've got qualified GPs who can't find jobs at the same time as patients can't get access to GPs. I mean, this is just completely bonkers.
Same in midwifery.
Yeah, so we're dealing with that. I agree with you that other staff like yourself, practice nurses, other allied health professionals have got a role to play, but they are alongside GPs, and we are determined to fix the front door to the NHS in general practice. Of course, it's going to take time, but in terms of all the choices, you probably heard this in some of my answers already. In terms of trying to balance all these competing demands, I really have put my money where my mouth is when it comes to general practice. It won't fix all of the problems overnight or over the next 12 months, but it's a good start to fix the front door to the NHS in general practice.
Because the more highly qualified GPs and other health staff you have in GP surgeries and community healthcare as well, the less pressure on hospitals, arguably.
100%. I mean, like, if you can get a GP appointment, it costs the NHS about 40 quid. If you end up in A&E, it costs 400. So that's my frustration with the way that our predecessors have spent money, even when they put it in, is that, you end up spending quite a lot of money on worse experience for patients and less good value for taxpayers. And I've got to turn that on its head so we deliver care that's better for patients and better value for taxpayers.
Let me ask you, 192 billion is the projected budget for NHS England in 25-26, so this year and next. Is that money still available to you, or has it already been spent on the plans that were announced in the budget?
So I've been setting out some allocations since the budget, and I've got more allocations to announce in the coming weeks. When the budget
From that amount?
Yeah, when the budget was announced, there was a bit of people kind of saying, oh, hang on, you said no investment without reform, and you've just announced a load of investment. Well, no, I only got the investment out of the Chancellor because it's linked to reform, and what we're publishing over the coming weeks are a whole series of funding streams directly linked to reform, because I've got to make sure that every single penny that goes into the NHS is as well spent as possible, because there are so many other challenges, whether challenges in people's pockets or any number of challenges in the public sector, from crumbling school buildings, overflowing prisons, courts backlogs, child poverty, police on the streets, you name it. I mean, the challenges are enormous. And that's why, to be honest, we've had to take some unpopular decisions in the last 6 months, because the country was in a massive hole. And Keir's view is take unpopular decisions now because they're the right decisions, and the country might see the change and thank you down the line. What they definitely won't thank you for is if you duck the difficult decisions, do government by gimmick, stick in plaster politics, and then in 4 years' time people are scratching their heads saying nothing's changed.
Can you do this and promise people that it will get better? Because it's not getting better yet. I mean, again, nobody would expect you to turn around the problems in 6 months, but on some measures, it's getting demonstrably worse. I mean, look at A&E, look at the ambulances, look at the waiting times, both elective and otherwise.
Yeah.
Can you promise it will get better?
Yeah, I want to see year-on-year improvements. And in fact, what the Prime Minister said yesterday on waiting times, for example, getting back from 18 months where we are today to 18 weeks, which is the NHS standard for planned care, if we pull that off, that will be improvement on a pace that even the last Labour government didn't achieve. So it's an ambitious target.
And if you don't?
But we're going hell for leather. Well, look, if we don't, it's my head on the chopping block, because the Prime Minister won't be happy with me, and neither will the public. And we're going hell for leather on this. I mean, as I say, the challenges across the country in the NHS and social care alone are enormous. Taken together with all the other challenges, the challenges are enormous. And that's why I just say to people, give us a bit of time, give us the benefit of the doubt. And where we're making unpopular decisions, it's not because we think, oh, what we really want to do today is cheese off a load of people across the country with something unpopular. It's because we think we've got to get this country out of a hole. We've got to make decisions now that people might not like now, but they will thank us for later if they see improving schools and hospitals, and if the pound in their pocket is going further, if we're improving wages and improving the economy. So that's what we're going for. It will take time, and the Prime Minister is determined to deliver the change that people voted for.
I hate to end on a harsh note, but I do think that if in 4 years' time 80-year-olds are still on floors or on trolleys in corridors in our hospitals, you've failed.
Yeah, well,
Would you agree?
I think that's fair, and I will come back, not just next year, by the way. I'm sure I'll be coming back. I hope I'll be coming back long before then, because I enjoyed this. But I am determined.
It should never happen, should it? You know, we talk about never events in the NHS. There should never be a frail elderly person treated the way they are being treated currently, some of them in the NHS, not because somebody's deliberately doing it, but because of the system failure, which you've described on a number of occasions. That should be a never event.
Yeah, and it breaks my heart because, and I've seen this when I've been shadowing the ambulance service on ride-outs. You know, we are taking people in ambulances to emergency departments to die because then there isn't the right care available at the right time in the right place, including end-of-life care. No, and I'm not going to waste my breath on how awful it is we got to this place because we had that argument and we won the election. What I'm determined to do and what I am doing is use every minute that's been given to me in this job, in government, thanks to the voters and thanks to the Prime Minister, to make sure I don't let people down. I'm determined to save the NHS that saved my life and to build the national care service this country deserves too.
Thank you very much indeed, Wes Streeting, Secretary of State for Health and Social Care and Labour MP for Ilford North. Thank you to you for all of your calls. I know some of you didn't get through to the Health Secretary himself, but we can continue the conversation after the news headlines. Amelia Cox has those.
The UK is seeing a second day of travel disruption because of wintry conditions. There are 2 new weather warnings for Scotland and Northern Ireland and a danger to life warning along the River Soar in Leicestershire. Nigel Farage has admitted losing Elon Musk's support would damage Reform UK, but the pair's relationship can be mended. The billionaire has suggested the Clacton MP doesn't have what it takes